let's move into some questions about soothing. This one is from Johanna C17. What are signs my baby is full and needs to be soothed rather than fed? Soothing is so important right now, but ironically, soothing can be really stressful and challenging. So know that it's okay, like really okay, to not know your baby's cues right away. Especially in the first few weeks, baby's cues are not going to be that reliable. Keep in mind, he is not fed before, he's not been out of the womb, and he's learning about what he needs to, so you have to give yourself some grace on this one. After 2 to 3 weeks, however, his feeding cues will become more obvious and a natural feeding schedule starts to be identified. You have to trust yourself in this process, and once you begin to notice this natural feeding pattern, times of fussiness outside of the normal feeding times become more clear. It is at these moments that experimenting with various soothing methods are important. If your baby is unable to be soothed, try to feed. I mean, the worst thing that could happen is if you feed a baby when he needs to be soothed is that he's going to puke because he ate too much. Now, if that happens, it's certainly okay. Both of you will have likely learned something and you will try to avoid doing that again. This one comes from Debs, Deb with a Z, Debs03. How to transition from the Soothy pacifier when my baby won't take another pacifier and gags. Now I know you guys all recognize this. It's the Philips Avent Soothy pacifier. Over 2,000 hospitals in the US give newborns this pacifier, which is sized and shaped perfectly for a baby's developing mouth. It also has one-piece construction that adheres to the American Academy of Pediatrics guidelines. But as much as we love this Soothy, so do our babies, and it can make it really tough to transition to different pacifiers. But it's important to make pacifier changes to allow growth with your baby. As your baby's mouth shape changes and baby grows, you have to be able to up-level the pacifier too. Comfort, of course, is a pretty personal thing, so Philips Avent created a range of pacifiers to suit every baby's need at every age. An early introduction to various pacifier materials and shapes is best practice. But if your baby is addicted to the Soothy and unable to make the switch to a developmentally appropriate pacifier, you may want to consider it an opportunity to wean from the pacifier altogether, depending on your family's goals. Safe teething toys, for example, could be used as comfort items as well. But if you're not ready to get rid of the passy, it's all about offering a variety of pacifier options, trying to encourage baby to try something new. And with patience and perseverance, it will happen. If you're a little overwhelmed by all the choices of different types of pacifiers, Philips Avent created a guide that will walk you through how to choose the best pacifier for your little one. So check that out. All right. Oh, this is from Katrina Solney again. My baby loves her soother, but can't keep it in. Why? I hear this question a lot, especially from my breastfeeding moms. What most parents don't know is that the mouth movements used to breastfeed are different than the mouth movements babies use to suck on a pacifier. So to get milk out of the breast, for example, baby is extending her tongue, pushing the nipple of the breast to the roof of her mouth, and then drawing her tongue back in while drawing milk out of the breast. Now think of this motion when you put a pacifier in a baby's mouth. The baby's natural reflex is to push out with his tongue, causing the pacifier to pop out. So to help this frustrating cycle, many of my families turn to the Soothing Snuggle. This is a cuddly, soft, cute little plush toy with the Soothy attached. The plush toy is super soft, it's lightly weighted, so it can help the Soothy stay close to baby as he is learning to suck for comfort. It keeps the Soothy in place and keeps him company. There are two very practical reasons that I recommend the Soothing Snuggle over other products. Again, practicality is key. Now for this one, the plush toy is compatible with all Philips Avent Soothies and pacifiers, so you can mix and match to create the product that is just right for your baby. Plus, the The Soothed detaches from the plush, so it allows both the pacifier and the plush to be properly cleaned using an appropriate cleaning method for each part. This is from Deb Z03 again. She asks, when I lay baby on his back to sleep, he rolls to his belly. If I move him back over, he wakes up. Is it okay to keep him there? This is a great question. I love talking about safer sleep. The answer is that all babies should be put back to sleep on a firm, flat surface. Plus, babies should be in his or her own sleep space in the same room as you, but not the same bed as you. Now, when a baby is able to roll on her own from the back to sleep position to her belly, she can safely stay on her belly. There is no need to keep flipping her over if she is getting to that comfort position on her own. And maybe next time we can talk more about setting up a successful sleep environment to promote baby sleeping through the night. Like, everybody loves that topic. I'm going to be doing 3 more videos this year with Philips Advent, and I want to know what you want to talk about. More on feeding tips, milk storage, formula preparation, sleep. Keep following Philips Advent for more advice and resources, plus look for your opportunity to ask your questions with the Moms Get Real hashtag. I want this time to be helpful for you and all of the other moms out there who are navigating the new abnormal. We are all in this together. Until next time, I'm Dr. Natasha Burgert. Take care and be safe.